Good morning. This is Dr. McDaniel at GYN Corner. Let's see, today's Tuesday, July 9th, and as the title stated, I'm speaking about molluscum, and it's called Molluscum Contagiosum. So I decided to speak on molluscum because I'm going to say fairly frequently, maybe 2 or 3 times a month, maybe I'll have someone come in with concerns that they have genital warts, or questioning if it's just if they have acne of the genitalia, and then occasionally not noticing that they have this infection at all, and I have to discuss it with them because they have pretty obvious bumps. So Molluscum contagiosum is a skin infection. It's called a dermatologic disorder, which means it's a problem of the skin layer, and it's a viral infection. So molluscum is from what we call the pox viral family. So it's a pox virus, like smallpox is a pox virus, but of course it's not around anymore, except in one laboratory. So it's a pox virus, and it's a very highly contagious viral infection. It's from skin to skin contact. You'll see it predominantly in 2 groups, either daycares, nurseries, very young, small school-age children, because they're sharing saliva and touching toys and touching each other a lot, so saliva on the toys and spreading viral infections, putting everything in their mouth and touching each other, hands. So usually for small children, it'll be on their hands, arms, legs, or around the face area. So you'll either see it in small children or you'll see it in sexually active adults, and it will predominantly be in sexual areas, so genitalia. Obviously, I'm a gynecologist, I only see women, so it's anywhere on what we call the saddle area, so anywhere a woman's body would touch the saddle of a horse, if she's seated on a horse, is the saddle area. So from the pubic area all the way to the anal area, to the butt cheeks and vulvar regions, inner outer lips of the genitalia. I've also seen it, I think just twice, seen it in the breast area. Turned out these 2 women, they're significant others that they were having sexual activity with, they were rubbing their penises in their breast areas, between their breast and around the breast. So they were rubbing their genitalia on the women's breast, and these 2 women had a molluscum infection of their breast as well as the genital region. Sorry, usually molluscum look like very small, plump, robust zits or acne, except that they're flesh colored and they're usually pinkish. Doesn't matter what skin tone the patient has, they're usually pink, and they look kind of swollen. They start off as very tiny little dots, and then if given enough time, which is several weeks, they'll become very plump and swollen, almost bursting looking. Now, the textbooks and the journal articles always call them umbilicated, and that's because if you look at the swollen bump, and they're usually about the size of either from a needle head up to the size of like I guess a very small caper or BB shot. They always look very swollen, like they're about to burst, but they're very firm. They won't burst. And we call them umbilicated because right at the center, there's a little dark area or dot. And the catch is they're painless. They're usually not an issue. Occasionally, they'll be itchy, so someone will scratch them. You don't want to scratch them, you don't want to pop them or burst them, because the virus lives inside the material, the gunk that's in that pimple-looking, pink, swollen, slightly red bump or pustule. Now, molluscum is a very, very slow-growing virus, so usually it takes several weeks to a few months for that infection to manifest. Now, 2 people can be exposed to the virus. One can have evidence of it, or the molluscum pustules or growths or bumps, and the other won't. And that's because the immune system is responsible for suppressing the virus or allowing the virus to proliferate. It will often start off as one or two little pinpoint dots, red dots, and then they will slowly get larger, and spread. Now, usually if someone comes in with molluscum, I will ask them, did they have any new sexual partners or activities 2 to 3 months prior to when they noticed the bumps from molluscum. And that's because that's about how long it usually takes. 6 to 8 weeks minimum. Usually it's about 3 months time frame before someone has manifestation of that viral infection. And then oftentimes if it's just 1 or 2 dots, most people don't notice that, or they don't really pay attention, or they don't think it's any issue that's going to go away. And then usually within about another 2 to 6 weeks, it will often have spread. So in that small region or area where that they're looking at, they will have gone from 1 to 2 little pinpoint needle dot red dots to 4 or 5 or even more bumps. And like I said, the bumps can get to be quite a large size. Usually they're about 5 millimeters or so. So if you take a poppy seed and maybe double the size of a poppy seed, they're usually about that size when people come in because they've noticed them, but occasionally they can get quite large, the size of a BB shot or a caper, or slightly smaller. This is a sexual infection if it's in a sexual region. So that means that they got the infection from someone that they've been having intimate relations with. Now, we do not have a test for molluscum, so we don't have any blood tests. We don't have a culture swab that we can do in order to confirm that that person has molluscum. The only way you can potentially identify molluscum is to remove it. So snip it off with the scalpel, send it to the pathology lab, and the pathologists are able to confirm that the bump or the lesion or the growth that was removed is Molluscum contagiosum. I'm going to stop right there today with the diagnosis, and I'll be back tomorrow to continue speaking about Molluscum contagiosum, a skin disorder. Thank you for watching. This is Dr. McDaniel at GYN Corner. Please check out the YouTube channel. It's also GYN Corner. I've gotten quite a good number of people on a regular basis look at the Facebook pages, and I appreciate that very much. But please check out the YouTube channel. No one's going to the YouTube channel. GYN Corner on YouTube, and it's nice because everything is categorized and classified there, so it's very easy. Take care. Have a great rest of your Tuesday. We'll be back tomorrow on Hump Day. Bye.